Sure. Otherwise we can't do rhinoplasty. Okay. Right, give me a... Yep. Look on the sides. Yes. Yes. All right. So there are multiple issues, right? So it's deviated, it's a little bit droopy, there's a dorsum, it's quite broad, it's quite long. So we can address all of this. The length is good, but it's probably a little bit longer than what your face needs. This is also because it's making your lips hardly visible, like just this much of the lip is visible. So we need to take the tip a little high so that the upper lip is more visible, and also increase this angle. This angle is like very low now, it's only 60 degrees. We can take it up to 90 degrees. That gives, it's like a derotation of the nose, which means the length will reduce a little bit, 3, 4, 5 mm max. Apart from that, there's a deviation here, there's a bone there, there's a bone here. All of that we can do. And if you look at the side, it's coming like this, the bone. So that also we need to just take it back. So all of these things we can address. Plus, you also have some breathing issues, right?
The breathing issue is, like whenever I go for a long walk or when I was doing so much of work, right, I know my nose is very heavy to take the breath. That is how I used to feel.
Okay. But on a normal day, you're fine?
Yeah, in a normal day, I'm fine.
So you get breathless when you exert?
Yeah.
That's normal. All of us get that. That's nothing wrong with your nose. That's normal, yeah. I just have a look at your nasal septum. So then we'll know if... Okay, I can see this. You have some severe deviation of the septum, as you can see here. It's not totally obstructing, but there are some areas which is pretty narrow, and this is supposed to be straight.
Okay.
And you see it's like really deviated.
Yeah.
And deviated for a long distance. So I think we will definitely have to do septoplasty for you. Septal work has to be done so that your breathing is better. On the scan, it's more serious than your complaints.
Okay.
Yeah. So we will look at the nose septum as well, surely.
I'm so scared.
Why is that?
I don't know. Not for this thing. I'm literally so scared.
Scared about surgery, is it?
Yeah.
You've never had any procedure before, any time? None whatsoever?
No.
Yeah, but see, the good thing is, let me tell you, you're not going to feel pain.
Okay.
You won't feel pain, and when you even get anesthetized, you will not know. When you wake up also, you won't feel. After a day or so, some patients do have some light pain, or some discomfort around the nose, some heaviness and all that, but it's very, very bearable. First thing. Secondly, diet will be normal for you, so there's nothing to worry about the diet. And so there's nothing to worry. It's natural for patients or people to be worried about surgery, This is normal, but don't worry, it's going to be pretty smooth. I don't think you need to worry.
And how much time it going to take for
The surgery?
No, for the recovery part.
Recovery, so you're probably looking at a week, because you come from Hyderabad. Where are you coming? Andhra. So yeah, so you need to stay here for a week or 8 days, and another recovery will take 2 to 3 weeks, because we have to do a lot of bony work for you also, both in the septum. I showed you it's all bent and this and that, and also when it's bent, I cannot use that to build up on top. So we need to make it straight and stable, so I can bolster that effect to get the septal work done.
Okay.
Now, yeah.
I have to go for 2 surgeries.
Just one.
Okay.
No two surgeries, just one. We'll sort out everything. I'm just saying the procedure we'll do.
Okay.
And also I've written mostly you may not need rib. It looks like there's enough cartilage inside that I should be able to
I just
use.
want to, reduce this length.
Yes.
Actually, just to visible my upper
Correct.
part, and
Even
some-
here, this has to be made
this
proportional.
has to be-
We will do that. I will give you a good nice nose.
I saw one of the video, doctor. I was like very impressed with
Uh-huh.
the shape what you have given to that lady.
Okay.
So if you can give me that kind of shape, then
You can show me what is it that you saw.
I
earlier.
can
Sure.
show you.
So I just get an idea about what you like.
Yeah, I was like a big fan of you. I daily watch your videos.
Really?
Yes, I do. I do.
Thank you.
So whenever I open my phone, the first pop-up would be like from Richardson.
We also put a lot of like videos with blood and all that. Do you watch them or you don't? You skip them?
Which one?
In the same channel, I put a lot of ones with blood and all. Do you watch them?
No.
No. Okay.
I saw your COVID video when you were taking
Yeah.
Oh, those were a good times. Now looking back, a lot of free time and And you've been given appointment for tomorrow, is it, or is it today?
Today only.
Today only.
Mm-hmm.
Today seems a little difficult, little tight. Shall we do it tomorrow? In that case, what happens is we will finish everything for you. We'll work you up, take the blood test, everything, and then you can go and rest.
Mm-hmm.
Tomorrow morning, first case we can do, because we've already got 2 patients scheduled for the day, and then there's a third patient also there. So then it will become, if we operate for you, it will become late. Then you'll be fasting, and then last minute if we get delayed, then it's better to just keep for tomorrow morning. It'll be comfortable for everyone.
I could have saved that video.
No problem. You can show it to me again tomorrow if you want.
Yeah, I'll just search and show you.
Just
Yeah,
okay.
this one. The ad is coming up.
अभी बस अभी रुक अभी रो
Okay. Yeah, but the thing is, you like her final result, right?
Yeah.
Okay, done. But her situation was that the nose was very, very short, very, very shallow. I've taken a lot of rib and I've made her nose bigger.
Bigger.
In your case, it's a little bit opposite.
Opposite, yeah.
Why? Because you have excess of bone, excess of cartilage, just that the bones and cartilages are not in the right position. So we need to reshape it, basically recontour it. That's why I said you may not need rib. While for her case, I had said 100% you will need rib.
Sure.
So I understand what you're saying. You're saying you like the final result, right? You like a nose like that,
And
quite.
I'll show you my mom picture also.
Yeah, sure. That nose I can get you like that, surely. Maybe better than that.
I'll just
Because it's more difficult to get a well projected nose when the nose is very, very flat with rib. That's more difficult than to just reshape a nose. Yeah, this is easier for me. Yeah, so we can do that. No issues. And you have pretty soft skin. It's not like you have very thick skin.
No.
If the skin gets thicker, it gets very difficult, little bit more difficult to give you a pointy nose like the one you show me.
Okay.
But the nose is thin skin, so we can get that.
That is true. It's okay. It's completely one layer.
She's my mom.
Sorry.
So just similarly, I would like to see myself too.
But she doesn't have that thin pointy nose. You can get better than hers.
Yeah.
You should be able to get you a better nose. Done. Now you see he has thick skin.
Yeah, my husband. Yeah. he
That's
has-
hard, more harder than when you have like yours type of skin. So with your type of skin, we can get the kind of result you showed me.
Okay. Thank you, doctor.
Sure.